All right, here we go. Our favorite time of week. It's 8:15, and we're joined by Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, to talk about some senior health. Hey, Doc, how you?
Pretty good. How are you doing, Tommy?
I'm well, sir. Good to talk to you. According to the American Diabetes Association, there are approximately 500,000 people in Louisiana with diabetes, and alarmingly more so, 113,000 have no idea they have it. And is this because they don't actually know what to look for, or some other reason? Dr. Brent Wallis is here to help us out. People's Health joins us with some important information about this very serious condition. So, Doctor, diabetes is one of those things we all know of it, but perhaps a lot of people don't know about it. What is it?
Yeah, diabetes is very common. In fact, it's one of the most common things we see in clinic every day. And really, the best way to think about it, there's two main types that both are related to a functioning of insulin in your body, which is a hormone. So type 1, which is less common, is where the body just doesn't make any insulin. Whereas type 2, the much more common type, is where it doesn't make enough insulin or your body can't use the insulin that's around. And what insulin is used for in your body is basically to allow the sugars that you eat to get into your cells to fuel them. And type 2 diabetes is the one that we see much more often around Louisiana because it runs in families, and one of the biggest risk factors is being overweight.
So type 1 you can have no family history of, but acquire through habits or something like that?
Not usually habits, and there's a lot of research over the last 50 years or so with type 1 diabetes. It's thought that it's actually a destruction to the cells in your body that create insulin, so you don't actually make any insulin with type 1 diabetes.
Okay, what are some of the complications of diabetes, and why is it so important to manage?
Well, it's extremely important because if it goes undiagnosed and uncontrolled, really it causes problems with the blood vessels in your body. And there's, the easiest way to think about it is there's two types of blood vessels. There's big vessels and there's small vessels. And the big vessels are the ones that lead to your heart, lungs, and brain, and so it can lead to cardiovascular disease and stroke. Those small vessels are real common in your kidneys or in particular in your eyes or supplying your nerves. So that can actually lead to blindness or problems in sensation and feeling in your extremities.
So how will somebody kind of know, or some of the symptoms of diabetes that they can look for? Or maybe they'll hear you talk about them and say, wait a minute, that could be me.
Yeah, they're very common, and so we see a whole host of symptoms. Some of the most common are an increase in hunger or an increase in thirst, and that thirst can lead to increased urination as well. When your sugars are out of control, you can also feel very fatigued, and because it affects those vessels, it can actually cause slow healing, so cuts that you get on your body may be very slow to heal. Like I mentioned, it can cause problems in your eyes, so that can cause blurry vision. And then one real common problem with the blood vessels that lead to your nerves is it can cause a tingling or a numbness, sometimes even a burning pain in your hands and feet. I think the scary part about it, though, is, like we mentioned, there's a huge number of people with diabetes who have no symptoms whatsoever. They may kind of write off some of those symptoms, like the thirst, to being summer in Louisiana. It's hot out, so I'm drinking a lot more. But that's why it's so important to make sure that you get checked by your doctor to see if you might have diabetes.
You do want to stay hydrated, though, right? I know
Yeah,
they say,
definitely.
what I'm confused with, they tell you to drink a lot of water, but it depends on whether you're forcing yourself to do it. How would you determine that?
Yeah, diabetes actually causes an increase in thirst itself, so it's sort of an unsatiable thirst. So normally when it's hot out, you drink water, and after you've consumed a little, you feel better. But with diabetes, you don't. You just keep drinking, because your body is essentially trying to dilute down the sugar and flush it out.
All right, we'll take a break. We come back. We're talking about type 2 diabetes with Dr. Brent Wallis, Dr. B from People's Health, Chief Medical Officer of People's Health, Senior Health. If you have any questions or comments about yourself or maybe about your mom or dad, why don't you text them in to 504-260-1870, and I'll pass them along. One thing we're going to pick up on when we come back, sometimes there may not be any symptoms of type 2 diabetes, so if there aren't, how do you know you have it, and how important is it that you treat it? 8:20, time for traffic now on WWL. 8:25 on this Thursday, June 25th. Rain expected, but not as much as yesterday. At least that's what they're saying. A 60% chance for scattered downpours. And then that Saharan dust moves in. A 20% chance for showers tomorrow, 30% Saturday and Sunday. And it's going to be hazy as well. Dr. B is our guest. Pardon me. Chief Medical Officer of People's Health, Dr. Brent Wallis. And we're talking about diabetes. And before we went to the break, we were talking about type 1 and type 2. But with type 2, there may not be any symptoms. So, Doc, if there are no symptoms, how do you know if you have it?
So the really fortunate thing is that it's very easy to diagnose with a simple blood test. And so what you need to know is what is your family history, because family history plays into it strongly, and what risk factors do you have? And you should talk to your doctor about that. You know, in particular, people who are overweight or inactive, and really anyone between the ages of 40 and 70 should be screened for diabetes. And then there's a couple of groups in particular that we see a higher incidence of diabetes, in particular in the African American population, and the Latino or Hispanic population have a higher incidence of diabetes as well. And when your doctor checks that blood test, which may be just a simple finger stick that can be done in the office, you could be diagnosed with diabetes or possibly even pre-diabetes, which is when your blood sugar levels are higher than they should be, but you don't have full-blown diabetes yet. So that's a good time to identify the potential future of the disease so that you can address it.
So let's talk more about that pre-diabetes if we can, because I would imagine some people might be hesitant because they don't want to know, and they think, well, maybe if I am pre-diabetic, I'll just do what I need to do to take care of it. But actually, that's not the case at all, and it's not necessarily life-changing, is it? I guess what I'm trying to ask in my own clumsy way is one treatable and the other not, the difference between diabetes and pre-diabetes?
Yeah, definitely. I mean, you want to identify any, disorder or disease as soon as you possibly can. And the fortunate thing about identifying pre-diabetes is that it is actually curable. Once you progress on to diabetes, it's really only treatable. And while we're working on a potential cure in the future, we don't have one yet. And so what you're trying to do is identify, based on those risk factors, who actually may progress to diabetes as they get older. If you know that you have pre-diabetes, then you can change your lifestyle. And we see that quite often with people where we identify pre-diabetes, we tell them about it, they start exercising, eating better, and then they don't progress on to diabetes. So it's a warning sign to let you know that you need to change your lifestyle.
What kind of changes specifically, maybe when it relates to eating, some of the things you should or should not eat?
Yeah, I mean, in Louisiana, we love our food, we love our snowballs, and so sugar itself is not bad for you, but it's really balancing and making sure that you're not over-consuming carbohydrates and starchy, sugary foods. A high-calorie diet as well can lead to being overweight. And what happens is the insulin can't work as well when you are overweight. So any amount that you can drop allows the insulin that's still in your body to function better. Another thing that helps a lot is staying active and exercising. Exercise actually makes that insulin more effective and more useful within your body. So even walking or riding a bike can actually decrease your progression on to diabetes. And then really focusing on healthy lifestyle with your weight. Keeping your weight down can definitely help prevent you from progressing on.
Very interesting. All we got to do now is tell people how to find out more about People's Health if they want some information.
Sure. We've always got information on our website at peopleshealth.com/radio.
You can call 855-821-2666, and you can follow them on Facebook, Twitter, or Instagram as well. Thank you, Doctor. Very informative and very entertaining, and nice to talk to you again.
Thanks, Tommy.
You have a good day. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. You can go to peopleshealth.com/radio, 1-855-821-2666. You can always follow People's Health on Facebook, Twitter, or Instagram.